Hello, it's me again. As I've been reading the news, former Senator Daschle has now been given the daunting task of straightening out health care in the United States. Well, being is now a $2 trillion industry, we need to think real carefully on how we do this. The way I see it, right now there are three groups of people. You have those who have some form of public insurance, Medicaid, Medicare, basically those things that the government's been taking care of. You have those on the other end of the extreme, which have private insurance. They go to see the doctor in the hospitals bill the insurance company, and then the individuals pick up the pieces. Both of those two groups are pretty well divorced from the cost of their health care, unless they actually read some of the paperwork they get in the mail, which usually ends up in the round file. At least around my house it does. But the concern lies with those in the middle. When you go to the doctor or go to the hospital and they ask, how are you paying for it? And you have to say, well, I'm self-pay. Those are the ones that are in the bind. And those are the ones that the reform is really intended to address. But how are we going to accomplish this? If we go toward a more government-paid system, like a single-payer system, or just some form of one size fits all, I'm wondering whether or not we would bankrupt the country. I mean, granted, they already spend billions of dollars on health care dealing with Medicaid and Medicare. But can our government absorb the other portion of that $2 trillion industry without having to cut costs? And when it comes to cutting costs, unfortunately, it's the end users, the people who need the care, that get stuck. There's all kinds of horrible predictions pertaining to rationing of care and poor, the quality of care going down because people can't go anymore and access. Well, I can't say one way or the other on that. Or, we can go to the other extreme and require that everyone be covered by some form of private insurance. In fact, the Hillary plan back in '93 alluded to some of that. But then we get into a different problem. If it is private insurance, then certainly there have to be premiums and some cost to the consumer. Well, who sets the price of those premiums? The private industry, the private insurance companies. And, well, let's face it, I believe there are a lot of people out there in that middle ground of self-pay. They're self-pay because, well, they can't afford the premiums. Either their job doesn't provide them with insurance, or the insurance they provide is of poor quality. But if they get stuck having to pay the premiums, well, the only way to ensure universal care is to ensure they pay it. And, well, that means the government's going to have to get involved and force people to pay it. And then we start looking more and more like the other situation. Well, the government will just take care of it all themselves. And then we get all kinds of horrible predictions by naysayers. I think a lot of effort is going to have to be put through this to think it out without screwing up either our government or screwing up the people we're actually trying to help. So these are the kinds of issues that worry me. I'm fortunate. I have private insurance at this time. But if our employers have to pay to cover everybody they have, from the lowest person all the way up to the CEOs, again, somebody's got to foot the bill. And I'm worried that it's going to be the people that we're trying to help are going to be hurt the most. Again, my thoughts for the day.